So yeah, the talk is called Philosophy and Classic Psychedelics, an overview of some emerging themes. Its title differs by one word from the title of the paper on which it's based. I'm not entirely sure why. But just to sort of define my terms from the outset, when I talk about psychedelics here, I'm talking specifically about classic or serotonergic psychedelics, which are a class of psychoactive serotonin 2A receptor agonists. The most famous examples are LSD, mescaline, psilocybin, and DMT. And I'm going to assume that most people in this audience know a decent amount about them, so I'm not going to give a lot of background on psychedelics and what they are, except to say that there's been this recent wave of renewed research into them. It's not that recent, it's been going on for 30 years now. And some of the major findings from this research are that psychedelics do seem to be physically and psychologically safe, at least when they're given in carefully controlled conditions to sort of carefully selected, screened and prepared volunteers. They seem to have therapeutic and transformative potential. So especially in controlled conditions, they seem to have the potential to cause lasting beneficial psychological changes with just 1 to 3 administrations. And they also seem to have a significant potential as research tools for the study of cognition and consciousness. So there are several studies using neuroimaging to look at how psychedelics alter the neural substrates of self-awareness and various other aspects of mental life. And so even though this research has been going on for, as I say, about 30 years, the recent wave of human research, it's only been in around the last decade or so that academic philosophers have started to take serious notice of this. So the talk is based on collaborative work with Jaipreet Mathur from the University of Western Ontario. It's just been published recently. It's just come out as a sort of online first publication in the last few weeks. That's the link there, and it's open access. So if you just search for it, you'll find it easily enough. And so what we did is we didn't conduct sort of formal or systematic review, so it's not totally comprehensive. We don't cover anything, but we looked at the academic literature, mostly the scholarly sort of peer-reviewed literature on philosophy and classic psychedelics from 2010 to 2020 inclusive, and we identified 4 main themes that seem to stand out. And so that's the way the paper is structured, and that's the way the talk will be structured. So first off, we've got issues to do with selfless consciousness, a topic in the philosophy of mind. Second, we've got psychedelic epistemology. Third, we've got a few sort of quite different issues actually that all cluster under the broad heading of ethics. And then fourth and finally, we've got issues to do with religious and spiritual naturalism. And due to the nature of the talk, it is an overview. I'm only going to give a sort of brief description of what's going on in each of these areas, and then I can go into more detail about any of them in Q&A if people are interested. Okay, so to start off, selfless consciousness. So coincidentally, for around the same time that human psychedelic research has been resuming, there's also been this interdisciplinary enterprise called philosophical psychopathology, which is sort of at the intersection of philosophy of mind and psychiatry and the study of abnormal psychology. And it's basically a project which aims to use evidence from psychiatric pathologies and in general altered states of cognition and consciousness as evidence for the philosophy of mind. So the idea is that by looking carefully at what happens when the mind breaks down or behaves unusually, we can reach empirically well-informed and comprehensive theories of the structure and function of the ordinary mind. And interestingly, you get a kind of feedback effect here. So it's not just one way with philosophers taking empirical evidence as constraints on their theorizing, but then when they theorize about what's going on in these unusual states, they also can develop sort of conceptual distinctions which feed back into empirical research. So out of this area, we've gotten things like the distinction between narrative and minimal self, which is now pretty commonplace in various areas of neuroscience and psychiatry, the distinction between the senses of agency and ownership, which I'm going to talk a little bit more about in a bit, and so on. So you've got this productive sort of mutual relationship where findings from the scientific and clinical study of abnormal or pathological conditions inform and constrain philosophical theorizing and speculation about the mind, and then the philosophical theorizing and speculation that is based on those findings feeds back itself into the empirical research. Now, in the philosophy of mind and in this area of philosophical psychopathology, there's an influential view or thesis which Raphael Millier calls the self-awareness principle. And this is the idea that necessarily whenever one is in a conscious state, one is minimally self-aware. So to unpack this, we just need to talk a little bit about the distinction that's commonplace in philosophy of mind between phenomenal consciousness and self-consciousness. So phenomenal consciousness here pretty much just is synonymous with experience. The idea is that a mental state is phenomenally conscious if there's something it's like, something that it feels like to be in that mental state. So we can think about things like, you know, the redness of red or the smell of coffee. These kind of basic sensory qualities are really what bring it out most clearly, what we're getting at with phenomenal consciousness. Just the having of subjective experience, being in a state that it feels like something from the inside to be. And so, you know, usually we tend to assume that other people are phenomenally conscious. You know, they have various states and there's something it's like for them to be in those states. We tend to assume that other animals, certainly other mammals, have phenomenal consciousness, even if we don't know what it's like for other animals to kind of see sights and you know, hear sounds and so on. We presume that there are experiential qualities that they undergo when they inhabit these mental states. Then on the other hand, self-consciousness or self-awareness is something more specific. This is the feeling of being someone who's having the experience, right? So most of you right now will be having, well, yeah, various visual experiences. You know, you'll be seeing colors and shapes and so on. You'll be having auditory experiences, hearing the sound of my voice, maybe some background noise and so on. And then, so the idea goes, simultaneously with all of this, you will have this sense, and it might be kind of elusive, it might be in the background, not something that you can identify readily or that you're paying a lot of attention to, but you also have a sense that there is someone who is seeing these things and hearing these things. There is some entity that is undergoing the experience, or someone that the experience is happening to. Now, we can go on drawing distinctions all night if we want. So when we have thus distinguished phenomenal consciousness and self-consciousness, people distinguish different varieties of self-consciousness as well. In particular, they talk about narrative or autobiographical self-awareness, which is your sense of being a specific person with particular history, trajectory through life, set of character traits and so on. And then on the other hand, minimal self-awareness, which is just the feeling of being an entity, being someone having experience in the here and now. So that's the distinction between narrative and minimal self-awareness. But it does get complicated, so I'll just leave it at that sketch for now. So the self-awareness principle says that whenever there's phenomenal consciousness, whenever there's any type of experience going on, there's also some kind of self-consciousness. There's at least some minimal accompanying sense of being someone who is having the experience, or the existence of some entity undergoing the experience. And interestingly, this is not just something we might care about for its own sake, but it turns out that a lot of prominent theories of phenomenal consciousness seem to entail something like the self-awareness principle. So there are prominent theories that try to explain what phenomenal consciousness is, you know, how experience actually comes about, how it comes about that mental states feel like something from the inside, and several of them try to explain it in terms of some kind of relationship between the experiencing subject and those mental states. So it seems like some of our most prominent efforts to explain what experience is, what phenomenal consciousness is, and how it comes about are actually committed to the truth of this idea that you can't have experience without self-awareness. So if this turned out to be false, that would be a big deal. You know, that would be interesting, not just in its own right, but also it would seem to have implications for several prominent theories of phenomenal consciousness. Now, several people have proposed that empirically there might actually be counterexamples to this self-awareness principle. There might actually be states in which people do have experiences, they do have conscious mental states that are not accompanied by any form of self-consciousness or self-awareness whatsoever. And several of these, of course, come from various pathological conditions. One of the most famous is so-called disowned mental states in depersonalization disorder, which is a psychiatric condition condition in which people describe feeling as though the self or the world is unreal. They can describe feeling estranged from their body and their mental states. And the condition varies quite a lot, but there are certain cases where people seem to be reporting experiences that they're undergoing that don't have any accompanying sense of someone to whom the experience is happening. So philosophers, of course, have gotten very interested, and a lot of ink has been spilled trying to analyze what really is going on in these states and whether they really are counterexamples to this self-awareness principle, you know, whether they genuinely are phenomenally conscious mental states, conscious experiences that don't have any accompanying self-consciousness at all. And people who are defending the self-awareness principle have two common responses that they make to these apparent counterexamples, right? So one thing they sometimes say is they analyze the first person reports carefully. They look really closely at what the people say, the patients who are suffering from this condition, and they say, look, it's not actually clear that the mental states they're describing lack all forms of self-awareness. And so this is where they go into analyzing self-awareness or self-consciousness in more detail and distinguishing between different forms of it. And in particular, one influential line that has been taken is to say, look, when it comes to our the sense of self that accompanies our mental states, our thoughts and feelings and so on, we can distinguish between the sense of agency and the sense of ownership, right? So the sense of being an agent who is kind of thinking the thought or making the thought happen, that's the sense of agency. And then the sense of ownership, which is just the feeling of being the person who is experiencing or undergoing the thought, the person that the thought is happening to. And so then what they say is, look, these disowned mental states in depersonalization disorder, they might lack the sense of agency. So people don't feel as though the thoughts are theirs or they're authoring or creating or generating the thoughts, but they still have the sense of ownership. People still feel as though the thought is being experienced by them. It's happening to them. It's happening in their mind. And part of the reasoning is, well, you know, why would they be bothered by it? Because a lot of the time people are very bothered by these sort of apparent disowned thoughts. Why would they be bothered by it if it didn't feel as though it were happening in their mind? So that's one line that sometimes gets taken, is to say, well, look, these mental states in depersonalization disorder, yeah, they are phenomenally conscious, people are experiencing them, but it's not true that they lack all forms of self-consciousness or self-awareness. The other way people sometimes go is to say, well, yeah, these mental states do lack all forms of self-consciousness, but maybe they're actually not phenomenally conscious. And that line of response can get quite complicated, because you have to ask, well, how are people reporting on these mental states? How are they describing having these thoughts if the thoughts are not actually phenomenally conscious? But suffice it to say that in at least some of these cases, there is an argument to be made here. You know, the first person reports are ambiguous. It's not clear what is really going on. And so philosophers who are sympathetic to this self-awareness principle have been able to say, look, maybe these apparent counterexamples aren't really counterexamples at all. Maybe they don't really show the falsity of this principle. So, enter psychedelics. At this point in the debate, several people have thought, well, some psychedelic-induced experiences might actually present really clear, unambiguous counterexamples to this self-awareness principle. It might be, in fact, that from the study of psychedelics, we get the best evidence we've had to date that there really can be conscious mental states that completely lack all forms of self-awareness. And so Raphael Millier, again, made this argument in a paper a few years ago. He sort of points to some examples of so-called full-blown ego dissolution. He coins the lovely acronym DIDE, drug-induced ego dissolution, for these states, and says that, look, in some states that people report on psychedelics, neither of the responses we've just looked at really seems to be plausible, right? Because in some of these cases, there's really strong evidence that all forms of self-consciousness are lost. In fact, in some cases, people are reluctant to use the first-person pronoun when they give retrospective descriptions of these states. They're really reluctant to talk about it happening to I or me, and they say that doesn't seem right, that doesn't seem appropriate to what really happened. So Millier says it's not clear that you can take sort of the first option there and say there's still some form of self-consciousness or self-awareness being preserved. But on the other hand, he says it's not clear you can go the other way either and say maybe these states are not really phenomenally conscious, because all of these reports are very emphatic that these were conscious experiences. In fact, they're very often among the most memorable experiences of people's lives. So there's one case in which evidence from the study of psychedelics has been brought to bear on a question in philosophy of mind. We've sort of got this seemingly intractable debate about, are there really phenomenally conscious experiences that totally lack all forms of self-awareness? And you know, we've had various apparent counterexamples from the literature on psychopathology, and their status is quite contested. And then the argument has been made that evidence from psychedelic research actually furnishes very clear and decisive counterexamples against this principle. Of course, this being philosophy, it doesn't end there. And so there are responses to this argument as well. And I'm wondering at this point in how much detail I'm going to go into here. So there's one response to the kind of argument that Milliere is making, which invokes this idea of for-me-ness, which is an idea drawn from the phenomenological tradition in philosophy. And in all the different forms and subtypes of self-awareness that philosophers like to distinguish between, for-me-ness, this sense of an experience being for me and not for someone else, is supposed to be the most minimal form of self-consciousness possible. And so people who advocate it say, look, it's not really an aspect of what is experienced, but it's an aspect of how it's experienced. It's a constitutive manner of experiencing. And so people who favor this idea of for-me-ness say it's just not possible. Indeed, it's not conceivable for a conscious mental state to lack this feature, because every conscious experience that ever occurs has to be first personally manifest to someone and not someone else, right? So every experience that happens privately within some individual's sphere of conscious experience. It's present to or for that person in a way that it's not present for anyone else. So this is the idea, is that simply by virtue of being a conscious experience, every conscious experience has to have this minimal feature of for-me-ness, even if it lacks some of these other forms of self-awareness, like the sense of agency and the sense of ownership and so on. Well, I've sort of come into bat at this point, and I've tried to defend the psychedelic argument in the face of this for-me-ness response. I should say, by the way, that of the four topics I'm going to look at, this first one, the selfless consciousness question, is maybe not the best one to start with, because it's definitely the most involved and complex. But this just happens to be the way the paper is structured. But the other three don't go into nearly as much sort of detail as this one. But basically, yeah, I don't think I will try and spell this out. I think I can go into detail in question time if people are interested. But what I've tried to show in a paper that I've written is that when people are making this for-me-ness response and saying, look, these psychedelic experiences still have to have at least this minimal form of self-awareness, I think there's some inconsistency in the way they're arguing. And in particular, I think they're sort of equivocating or sliding between two different definitions of for-me-ness, two different ways of understanding exactly what for-me-ness is. And if you understand it in one way, then I think it's pretty clear that at least some of these psychedelic experiences do lack it. But then if you understand it in the other way, I think it turns out to actually not really be a form of self-consciousness at all. It happens to just be something like the fact that an experience is happening in one brain and not another. And so it's not really relevant to talking about self-consciousness, which is this feature of experience. So I don't know how clear that is at that level of abstraction, but hopefully the big picture is sort of emerging out of all this anyway. But we've got more problems. So even if my response to the for-me-ness people works, it turns out there are still several other issues that can be raised in relation to this use of psychedelic evidence to try and undermine or refute the self-awareness principle. So what we're doing here, or what some of us are trying to do, is we're trying to say, look, we've got this body of evidence, these first-person reports about psychedelic experiences, and from this evidence, we can make an inference to the conclusion that there are such things as conscious experiences that lack all forms of self-awareness. But it turns out there are a lot of problems. If you sort of scrutinize that inference really carefully, there are several issues or problems that can be raised. For one thing, some people have said, look, the reports themselves are actually ambiguous between whether they're really describing a total dissolution, a total loss of self-awareness, or something else, such as an ego expansion, a loss of ego boundaries. The point has also been made that, psychedelic experiences are notoriously ineffable. People very standardly emphasize that they're kind of beyond words, impossible to describe adequately, very difficult to conceptualize. And so in relation to that, the point can be made that, when people do come to try and conceptualize them and verbalize them, we can't discount the possible role of bias and sort of cultural transmission in framing the experiences. And so it might be that some people who come to describe their experiences as ones of total self-loss or a total absence of self-awareness are, for instance, being influenced by Buddhist ideas in how they're describing these experiences. So it's very hard to get at kind of with any great degree of confidence what the experience itself was really like before the person came out of it and started trying to conceptualize it and verbalize it to give us these reports. And then there's finally a worry that goes back several years to Thomas Metzinger, who was sort of thinking and writing about these experiences before very many people in academic philosophy were. And he sort of posed this question, like, if someone is reporting on an experience of this kind afterwards, and the experience was supposed to completely lack self-awareness, then how can there be a trustworthy autobiographical memory of such a state? Because the idea is that in an autobiographical memory, we sort of recreate or we represent an earlier experience and we represent it as having happened to us. But the thought is, if these states, if these psychedelic experiences really don't have any form of self-awareness or self-consciousness, then when you undergo one at the time, you can't be experiencing it. You can't be representing it as happening to you, because by definition, you're not experiencing it. You're not representing it as happening to anyone. So Metzinger's point is that if afterwards you've got an autobiographical memory of having gone through an episode of total self-loss, it has to, in some sense, be a confabulation. It can't be a kind of accurate memory of what you were really undergoing at the time, because you're sort of superimposing yourself on it retrospectively or something like that. So those are just a few more worries, and that's pretty much where it stands at present. So it's safe to say that psychedelics didn't quite come to the rescue and sort of end this debate once and for all. Some of us do still think that they provide strong evidence, pretty decisive evidence against the self-awareness principle, but there's still a lot of work to be done, both in terms of evaluating the philosophical arguments and also in refining the actual tools, the instruments that we use to do scientific and psychiatric research on these states. So that's just a bit of an overview of one way in which psychedelic research has interacted with the philosophy of mind. So now on to part 2, psychedelic epistemology. And as I said, hopefully the next 3 sections, this one is the second longest, and then sections 3 and 4 are both pretty short, I think. So epistemology, for anyone who doesn't know, is the study of knowledge. It's the branch of philosophy that studies the nature, the definition, and the acquisition of knowledge. And this is a field, of course, that is very relevant to the study of psychedelics, because people often claim to have gained knowledge from their psychedelic experiences. It's not uncommon at all for people to come out of a moderate to high dose psychedelic experience, whether it be in a therapeutic setting or a religious or ceremonial setting, feeling as though they've learned something about themselves or about the world. And one very common example is metaphysical knowledge, so knowledge about the ultimate nature of reality. So especially in the famous mystical experience or mystical type experience, which seems to play a crucial role in the therapeutic use of psychedelics, often people come away with a newfound conviction in the existence of some transcendent or divine sort of level of existence or dimension of reality. And the eminent religious scholar Houston Smith said, the basic message of psychedelics is that there is another reality, capital R, that puts this one in the shade. And although the details vary, it is clear that a lot of people come to believe something like this on the basis of their psychedelic experience. And they don't just come to believe it, they feel as though they've come to know it. They feel as though they've gained direct knowledge of the existence of some kind of transcendent or divine reality underlying or permeating or giving rise to the everyday empirical world that we know. But a lot of philosophers, myself included, are very sympathetic. A lot of contemporary philosophers are very sympathetic to a worldview that's broadly known as naturalism or materialism, which says, in essence, there is no other reality, right? Everything that exists is part of the same single closed system, the same kind of reality studied by the sciences, and there is no spirit world, there is no cosmic consciousness. Reality is wholly exhausted by the material or the physical. And so in that context, a lot of recent philosophical analysis of the psychedelic state has focused on the question, if that sort of worldview is correct, if a naturalist or materialist worldview is correct, are there nonetheless types of knowledge that people might gain from psychedelic experiences, or types of, to put it more broadly, are there epistemic benefits, where the adjective epistemic just means knowledge related, pertaining to knowledge. So we've got here Benny Shannon, who wrote a monograph. He's a cognitive psychologist who also has a background in philosophy, wrote a monograph on the ayahuasca experience back in 2002. But in a paper from 2010, he sets out various types of epistemic benefits that he thinks people might gain from ayahuasca-induced experiences. And I'm not going to give a full survey here. I'm just going to mention some of the types that he proposes. So one thing he says is psychological insights, right? So it's very common for people who take ayahuasca or indeed other psychedelics to feel as though they've gained some kind of direct insight, some kind of novel comprehension of their own personality or behavior or motivations, some insight into how their mind works or functions in general. If they take ayahuasca in a group setting, they might feel as though they've gained insight into the personality or behavior or motivations of other people. And this general idea is consistent with some more recent quantitative evidence. So there are some psychometric questionnaires that have been developed, and it turns out that this idea of this sense of gaining a psychological insight is indeed very common in moderate to high dose psychedelic experiences, and it seems to predict some therapeutic benefits. There seems to be a correlation between feeling as though one has had psychological insights and then having subsequent reductions in depression, anxiety, and so on. What Shannon doesn't really get into in much detail is why we should think these insights are genuine, right? As opposed to false insights that merely feel genuine. He does say in the case of insights about other people that, look, it would be possible to test this empirically, but it's worth considering that even with insights into one's own mind, they could still turn out in some cases, in most cases, in all cases, to be drug-induced confabulations rather than genuine insights. So how to tell the difference is a big question that doesn't really get addressed deeply in any of the work I'm going to be talking about. But another category that Shannon talks about, he says, well, he describes it as coming to see things in a new light. And I think it corresponds to a type of epistemic benefit that philosophers call new knowledge of old facts. So it's when there is something that one already knew, a fact that one already knew, but one comes to know it in a new way. One gains some new type of knowledge that very often amounts to grasping it in a more complete or vivid way, really seeing what it means. And so he gives his own example here. So I should say that his book is quite remarkable because it's based on, he himself had over 230 experiences with ayahuasca in Amazonian regions, and then he interviewed a couple of hundred other people who were drinking it as well, and then he creates this whole taxonomy of different types of experiences based on his own experiences and the reports of his informants. But this is one of his own examples. He participated in this ayahuasca session in a hut in the midst of the Amazonian forest. It was early in the morning, and he was looking at the leaves of plants, observing how they were directed toward the rays of the sun. And he felt he was actually seeing the nurturing sustenance of the solar light. And he says, look, have I obtained any information I had not known before? I doubt it, but I was open to see the world in a new light, perhaps in the manner a poet or an artist may. And he goes on to give some other examples of common themes that pop up in these kinds of experiences where people feel that they come to see the world in a new way and really sort of see or feel the truth of something they already knew, even though they may not have gained any new factual information. So those are two of the sort of types of epistemic benefits Shannon talks about. Here's two more. So in epistemology, it's standard to distinguish between knowledge that and knowledge how, right? Propositional knowledge and ability knowledge, as they're called. So knowing certain facts or knowing that something is the case versus knowing how to do something, knowing how to ride a bike, knowing how to program a computer, this kind of thing. And Shannon actually proposes that when people repeatedly consume ayahuasca, they may gain a kind of knowledge how. He doesn't explicitly use that term, but it's clear, I think, that that's what he's talking about. And he says, longitudinally consuming ayahuasca, people may eventually become accomplished in the very art of drinking ayahuasca. Drinking ayahuasca is an artful skill in its own right, and as such has to be mastered. So that's a very intriguing and suggestive comment. And I actually have some thoughts about what that might amount to, but I can't go into them here because they fall outside the scope of this review. So if anyone wants to know, I can talk about them in question time. And then finally, Shannon makes the point that, look, whether or not ayahuasca drinkers can actually discover anything new about the external world, they certainly encounter novelties in the domain of subjective experience. So they can gain knowledge about consciousness and the potential of consciousness. Psychoactive agents reveal heretofore unknown territories of the mind. These, by the very fact of being experiences, are psychologically real, and whoever is confronted with them is indeed beneficiary to novel discoveries. So this last proposal by Shannon sort of connects with a proposal that I made in a paper a few years ago, and this is a third concept. So very often in epistemology, especially in the tradition of analytic philosophy, it's standard to distinguish between three types of knowledge. So as I said before, there's knowledge that, or propositional or factual knowledge. There's knowledge how, or ability knowledge. And then the third type that often gets mentioned is knowledge by acquaintance. And the term and the idea go back to Bertrand Russell, although the idea crops up sort of in different places. But talking about it as knowledge by acquaintance goes back to Bertrand Russell in the early 20th century. And we don't need to get into the technicalities, but intuitively, it's about kind of coming to know something directly or firsthand rather than indirectly through testimony or book learning or theoretical knowledge or something like that. And so in this paper, I suggested that users of psychedelics can sometimes gain knowledge by acquaintance with certain facts, in particular, two important modal facts about their own minds. Now, modality in philosophy refers to possibility, necessity, impossibility, and things like that. So if we're gaining knowledge about modal facts, then we're gaining knowledge about what is necessary, what is possible, what is impossible, this kind of thing. So what I said is, this is what people look like when they gain this knowledge, by the way. This is the face they make. So I said, look, there are two modal facts about the human mind, two facts about what is possible and impossible and so on for it, that are pretty easy to know about indirectly, to gain sort of secondhand or inferential knowledge of, but are less easy to know about firsthand through one's own experience. And the first one is that the human mind has vast potential, including the potential for states of harmony, ecstasy, wonder, and awe that typically goes unrealized in the ordinary sober waking state. And the second point, the second fact, which connects with the earlier discussion of self-awareness, is that the ordinary sense of self, the sense of self that we have in normal everyday waking consciousness, far from being necessary, is in fact contingent, constructed, and mutable, right? So it's something that can possibly be radically altered or possibly be altogether absent. as I say, it's easy enough to gain some kind of theoretical knowledge of these facts by reading Aldous Huxley, or by reading Buddhist texts, or reading philosophy of mind and neuroscience and so on. You can come to know that the mind has potential to enter all these different states, and that the ordinary sense of self can be radically altered or can be altogether absent. But under psychedelics, the potential that fact one refers to can actually become manifest in one's own mind, and the sense of self that number two refers to can actually be radically altered in one's experience, or totally absent from one's experience. And so then you come to have far more direct knowledge. You come to know firsthand through your own experience that your mind has this vast unrealized potential, and that your ordinary sense of self is contingent, constructed, and mutable. So I'm starting to suspect, speaking of what's possible and impossible, I'm starting to suspect I'm not actually going to get through all of the talk in the 45 minutes. Erin, how long have I actually got at this point?
It is 40 now, but honestly, don't worry. Just go, yeah, you can finish the presentation. It's fine.
Thanks. I think what I'll do is I'll get through the rest of section 2 properly, and then I'll skate over 3 and 4 and see what people want to zoom in on.
Yeah.
All right. So I'll finish the epistemology bit. So I have also suggested that people can get indirect epistemic benefits from taking psychedelics, especially in controlled therapeutic conditions. So epistemic benefits that don't come from the psychedelic experience itself, but that come from the lasting effects of the psychedelic experience. And so this is particularly pertinent to therapeutic uses. So the thought is that cognitive rigidity and an inability to vividly imagine alternative possibilities for oneself are characteristic of certain conditions that psychedelics show therapeutic potential for, such as addiction, depression, anxiety, and so on. And the idea is that when psychedelics durably alleviate symptoms of these conditions, as they seem able to do, it's plausible that in so doing, they actually restore this diminished imaginative capacity, right? They restore people's cognitive flexibility, and they restore their ability to vividly imagine alternative possibilities for themselves, things that could happen to them, ways they could be, ways their lives could be. And to invoke some of the concepts I introduced earlier, this actually amounts to a restored capacity to access putative modal truths about oneself, right? To at least entertain possibilities about, or ideas about, what could be possible for one. And interestingly, there is a bit of empirical evidence in favor of this. So there was one small study that showed that after being successfully treated for depression with psilocybin, people became more accurate at estimating how likely various things were to happen to them in the next month. And interestingly, they didn't, let me see, I've got to remember and get this right. When it came to estimating the likelihood of various negative things happening to them, there was no change, right? So before the treatment, while they were still depressed, and after treatment, when depression had alleviated, they still had the same level of accuracy when it came to how likely are these bad things to happen to you in the next month. But when it came to good things, the accuracy got better because they'd systematically been underestimating it. So while they were depressed, they were underestimating, you know, they would kind of say that only 5 or 6 of these 20 good things are going to happen to me in the next month, and then really 10 or 11 of them would, right? But then after they'd been successfully treated with psilocybin, the numbers became more accurate. So it's a bit of a leap, but one way of interpreting that is what had gone on is they had regained their ability to imagine or to mentally simulate good things happening to them, which is something that had been impaired while they were suffering greater depressive symptoms. And finally, more indirect epistemic benefits. So in another paper, I adopted an argument from the philosopher Lisa Bortolotti. So she has this whole sort of fascinating research program looking at the epistemic status of pathological states like delusion and confabulation and things like this. And so her project has been to say that, look, we actually need to reevaluate the epistemic status. We tend to assume that conditions like delusion and confabulation and so on are nothing but bad news from an epistemic point of view, right? From the point of view of gaining knowledge of the world, all these sorts of conditions do is impair our ability. They create false beliefs. They take us out of touch with reality. But her sort of position is that, well, conditions like this do have epistemic costs, of course. They do involve false beliefs or inaccurate representations of the world. But she says in some cases, via their sort of flow-on psychological effects, they can also have substantial, significant epistemic benefits. In some ways, false beliefs, delusory beliefs, confabulations, and so on, can actually have benefits for our sort of endeavor, our attempt to gain knowledge of the world and hold true beliefs. Well, how might this work? Well, one example that Bortolotti talks about is what have been called motivated or defensive delusions. So this class of delusional beliefs that have been held to play a defensive psychological role. And so the easiest example to get your head around is anosognosia, which is the denial of illness. So it can happen sometimes that people who have very serious injuries or illnesses will, with all apparent sincerity, deny that they are. They'll kind of deny that there's anything wrong with them. And in some cases, at least, it seems somewhat plausible that this denial, this seemingly sincere denial of an obvious illness, is playing a psychologically protective role, right? It seems in some cases as though if the person were to admit the truth, if they were to acknowledge the truth about their situation, this could very well have debilitating psychological consequences, right? It could induce catastrophic despair, maybe even depression. And so the delusion seems to be playing a defensive role, sort of protecting the person from debilitating despair or total psychological collapse. So then Bortolotti says, look, granted that that's what's going on in some cases, granted that some delusional beliefs really are playing a defensive psychological role, sort of protecting people from debilitating despair and psychological collapse and whatever. In that case, she says, it follows that they not only have those psychological benefits, but they also have epistemic benefits too. And the reasoning is straightforward. It's just that our epistemic agency, you know, our capacity to acquire true beliefs about the world depends on our psychosocial functioning, right? So some of the main ways that we gain knowledge about the world are by engaging with it, moving around in it, exploring it, talking to other people, getting information from them, exposing our ideas to scrutiny, engaging in dialogue, and so on. And so Bortolotti's point is that if someone falsely believes that they're healthy, if they falsely believe that they're not ill, well, there's an obvious epistemic cost, right? They have an inaccurate belief about their health. But if that belief really is giving them these psychosocial benefits of kind of staving off debilitating despair and allowing them to keep kind of engaging with the world, exploring the world, talking to other people and so on, then that's also going to have flow-on epistemic benefits because it's preserving all these capacities and all these behaviors on which their endeavors to gain knowledge depend. So I've sort of taken that argument and adapted it very straightforwardly to psychedelics. And I've said, look, insofar as psychedelic experiences can have therapeutic and transformative effects, insofar as they can durably reduce symptoms of depression, anxiety, addiction, and durably kind of change personality in healthy subjects, this same principle is very likely to apply, right? Because by reducing symptoms of these conditions, the psychedelic experience is going to make people more likely to move around the world, more likely to explore it, engage with it, more likely to talk to other people, gather information, expose their ideas to scrutiny, and so on. And so the thought is that, again, by kind of preserving or restoring or boosting our psychosocial functioning, psychedelic experiences can have a flow-on epistemic benefit as well. They can improve our epistemic functioning because our epistemic functioning depends on our psychosocial functioning. It's not sort of completely separate or distinct from it. So those are a few proposals about kinds of epistemic benefits that psychedelic experiences might have, even if a materialist or naturalist worldview is true. Now, to just very quickly give an overview of the overview of sections 3 and 4. So there are some ethical issues that people have started to discuss to do with psychedelics. One of them connects to these epistemological issues. So it's one thing to ask, you know, do people gain knowledge, or do they just gain false beliefs or delusion through psychedelic experiences? It's another thing to ask, does it matter? And so there's been a bit of a debate about how much we should really care whether psychedelic experiences are giving people genuine knowledge, or just some kind of comforting delusion. You know, how morally important is that really? There's also been a suggestion that the nature of psychedelic assisted therapy, because it's this very novel and strange psychiatric treatment, which has the potential to sort of induce mystical experiences and change personality, maybe change religious beliefs and things like this, requires an enhanced consent process, right? So some philosophers have argued that the standard sort of informed consent procedures that are used for psychiatric treatments aren't adequate for psychedelic therapy because it has all these unusual and distinctive features. So we need to develop some kind of enhanced consent procedure and think about what sorts of things people really need to know and how fully they need to comprehend them before they can meaningfully consent to undergoing this procedure that might well alter their beliefs and personality on a fundamental level. And finally, this is not really an ethical issue as such, but there is this question about whether psychedelics themselves might function as effective agents of moral enhancement. So there's sort of a long-running debate about whether there can be biotechnological interventions that can be used as forms of moral enhancement, that can be used to deliberately improve the moral character or behavior of individuals. And some people have been arguing that the controlled sort of intentional transformative use of psychedelics might be actually the most realistic case of that we've seen to date. All the other cases, it's been suggested, are kind of unrealistic, far-fetched sort of science fiction, or they're kind of just too similar to boring old methods of moral education that we're already familiar with. But it's been suggested that, yeah, the transformative use of psychedelics might be a really interesting, feasible, but still genuinely novel method for moral enhancement. And that's sort of backed by some findings suggesting that psychedelic experiences can durably increase pro-social behaviors and pro-environmental behaviors and that kind of thing. So there's a cluster of issues to do with ethics. Skimming over all my lovely slides. And finally, there is this question that's been discussed in philosophy prior to psychedelics, and it's about the compatibility of religion and spirituality with the sort of naturalistic worldview that I outlined earlier. And the question is, might there be genuine or authentic forms of religious or spiritual practice? So things that can legitimately be called religious practice or spiritual experience that are in fact compatible with adherence to a naturalist or a materialist worldview. And I'm sorry, Erin, because I think you said this was a point you were particularly interested in hearing about. I'm going to skim over it more quickly than anything, but basically a couple of philosophers, Eric Steinhardt and myself, have argued that psychedelics give us some evidence for an affirmative answer. They actually show that there can be forms of religion or spirituality that are compatible with the naturalist worldview, and they give us some ideas about what form those might take. So that's it. That's the end. I'm well over time. I'm going to stop so there's at least time for a few questions. Thanks.
Well, thank you so much for that. That was such an interesting talk, and it's great to kind of see how psychedelics can fit into the naturalistic worldview. And I definitely learned a lot about philosophy because I don't come from a background in philosophy. So that was really, really informative and very interesting. So yeah, if you have any questions, please put them in the chat box. I think quite a few have already come through. So I can just read them out. Is that okay with you, Chris? If I just...
Oh yeah, please, yeah.
Read them out. Okay, so we've got the first one. So FOR-ME-NESS, perhaps another way of bringing that out is to say that even in instances of drug-induced ego dissolution, the experiences in question might still have qualia. There's still something it's like to have the experience, and so it still requires some degree of self-awareness. So.
Yes, but that's what they say, right? But, and I think a lot of the replies from the FOR-ME-NESS people take something like that form. The problem is that sort of response, I think, assumes that where there is qualia, there must be for-me-ness. And that's exactly the question at issue, right? And I think these debates get very subtle and very slippery, but I think this is exactly the way a lot of the for-me-ness people reason. They say, look, the experiences are still experiences. They still involve qualia, so they must have this for-me-ness. And what I've tried to say in response to that is that's actually presupposing